Today we are discussing about chemotherapy. Chemotherapy or called chemo is treatment with drug that block or slow down cell growth. Most often for cancer there are many chemotherapy drugs are often several given together. And now we are discussing about mechanism of chemotherapy. Chemotherapy damages the gene inside the nucleus of cells. Some drugs damage cells at the point of splitting. Some damage cells while they are making copies of all their genes before they split. Chemotherapy is much less likely to damage cells that are at rest, such as most normal cells. Now we are discussing about normal cells and cancer cells. Normal cells, small, uniformly shaped nuclei, relatively large cytoplasmic volume. And on the other hand, cancer cells, large variable shaped nuclei, relatively small cytoplasmic volume. In contrast to normal cells, cancer cells do not stop growing and dividing. This uncontrolled cell growth results in the formation of a tumor. Cancer cells have more genetic changes compared to normal cells. However, all changes cause cancer that may result of it. Normal cells repair or die undergo apoptosis when they are damaged to get old. Cancer cells are not repaired or do not undergo apoptosis, and they have lower levels of dividing cells in normal cells. How does cancer form? Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer develops when body normal control mechanisms stop working, and old cells do not die, and instead growth of control forming new abnormal cells. DNA repairs genes. What are oncogenesis? DNA repair genes are involved in fixing damaged DNA. Cells with mutation within these genes tend change in their chromosomes, such as duplication and deletion of chromosome parts. Together, mutation may cause cells become cancers. And on the other hand, in cancer, the extra cells may form mass of tissue called a tumor. Some cancers, such as leukemia, do not form tumors. What are the tumor suppressor types? In previous slides, we also know about normal cells and cancer cells. And on the other hand, what is tumor microenvironment? The tumor microenvironment TME is the environment around a tumor, including the surrounding blood vessel, immune cells, fibroblasts, signaling molecules, extracellular matrix (ECM). The tumor and the surrounding microenvironment are closely related to interact constantly. The tumor and the surrounding microenvironment. Tumor can influence the microenvironment by releasing extracellular signals, promoting tumor angiogenesis, and inducing principal immune tolerance. While the immune cells in the microenvironment can affect the growth and evolution of the cancerous cells. Listen to pronunciations. The normal cells molecule and blood vessels that surround to feed a tumor. Distant locations is of great importance in cancer. About 90% of the deaths due to cancer involve tumors that have spread around the body. The movement of tumor cells to other parts of the body is known as metastasis. Metastasis is a complex process during which cancer cells break off of the original or primary tumor and move through the body to form tumors at new locations. From the point of view of a cancer cell, this is a dangerous and often unsuccessful process. A trip through the body is full of hazards that cause the death of most cells that begin the journey, even tough cancer cells. To begin the process, individual cells must break away from the tumor and invade nearby vessels. The cells crawl along the surface of other cells and the fibrous, stringy structure surrounding them and then force their way in. Shown here is the invasion of the blood supply. Once inside a blood vessel, the cancer cells may perish from a variety of causes. Some cells die simply because they are unable to survive floating around in the bloodstream. Others may become damaged and die
when they squeeze through tight spaces or bump into the walls of the blood vessels. Still, other migrating cells may be recognized and destroyed by cells of the immune system. How and where the migrating cells stop is different for different cancer types. Once the tumor cells are no longer moving, they can begin the process of forming a new tumor by leaving the blood vessel and beginning to reproduce in the new location. This does not always occur, and cells that have made it this far may still die or fail to divide. If the new environment is suitable, the newly arrived cell will begin to grow.
Now, metastasis, cancer that spread from where it started to a distant part of the body, is called metastasis cancer. For many types of cancer, it is also called stage 4 cancer. The process by which the cancer cells spread to their part of the body is called metastasis. Metastasis and or metastatic tumor is one of has spread from primary site of origin. Many different kind of chemotherapy or chemo drugs are the used to treat cancer either alone or in combination with other drugs or treatments. These drugs are very different in their chemical composition, what they are made of, how they are prescribed, and given how useful they are in treating certain type of cancer and the side effect they might have every time any new cells is formed. It goes through the unusual process to become a fully functioning cells. The process involves a series phases called the cell cycle. Understanding how the drug work help doctors predict which drugs are likely to work well together. Doctors can also plan how often doses of each drug given based on the timing cells. And chemotherapy drugs target cells at different phases of cell cycles. Many different and cancer cells tend to form new cells more quickly than normal cells, and this makes them a better target for chemotherapy drugs. However, a chemo drugs cannot tell the difference between healthy cells and cancer cells. This means normal cells are damaged along with the cancer cells, and this causes side effect of each time chemo is given. It means trying to find balance between killing cancer cells in order to cure or control the disease, or sparing the normal cells to lessen side effect. The good news is that normal cell will recover from the effect of chemo over time, but cancer cells are muted; they usually do not recover from the effect of chemo. This is why chemo is good at killing many types of cancers. Now we're discussing about classes of chemo drugs. Alkylating agent, platinum compounds and nitrosaurines, antimetabolites and anthracycline, antimicrotubule agent, vinca and alkaloid taxanes, topoisomerase and inhibitors, antitumor antibiotics, and anthracycline and corticosteroid. Other chemotherapy drugs. And now we're discussing about drugs used in chemotherapy. Many different kind of chemotherapy drugs are used to treat cancers. And another question is, what is the strongest chemotherapy drugs? Doxorubicin, adrimycin is one of the most powerful and chemotherapy drugs ever. And now class antimetabolites, example 5-fluorouracil and gemcitabine and methotrexate. Biochemical activity, analog of pyrimidine nucleosides, and inhibit dihydrofolate reductase, add an alkyl group of 2 DNA. Biological effect, perturbation of RNA and DNA synthesis, reduction of folates required for DNA synthesis, and inhibition of DNA replication. Used in clinic in oncology, colorectal cancer, pancreatic cancer, non-small small cells lung cancer, pancreatic cancer, and bladder cancer, breast cancer. Another one is breast, head and neck leukemia, lymphoma, lung osteosarcoma, bladder and tropoplastic neoplasm, lymphomas, leukomies, brain tumor. The next class is alkylating agent, cyclophosphamide and dacarbazine and melphalan. Add an alkyl group of DNA inhibiting of DNA replication and lymphomas, leukomies, brain tumor, metastatic melanoma, and lymphoma, multiply myeloma, ovarian cancer, malignant melanoma. And third one is anthracycline, doxorubicin, intraclastrate base pair of nucleic acid, inhibition of RNA and DNA, leukemia, soft tissue scroma. Alkylating agents keeps the cell from reproducing, making copies of itself by damaging its DNA. This drug works in all phases of the cell cycle and are used to treat many different cancers, including cancer of the lungs, breast, and ovary, as well as leukemia, lymphoma, Hodgkin disease, and multiple myeloma and sarcoma. Because these drugs damage DNA, they can affect the cells of bone marrow, which make new blood cells. In rare cases, this can lead to leukemia. The risk of leukemia from alkylating agent is dose dependent, meaning that the risk is small with lower dose but goes up the total amount of the drug used get higher. The risk of leukemia after getting alkylating agent is highest about 5 to 10 years after treatment. And a mechanism of alkylating agents. Alkylating agents across linking strand of DNA, particularly at N7 position of the guanine, they are non-specific for the cell cycle phase. Platinum-based antineoplastic drugs, in form called platines, are chemotherapeutic agents used to treat cancer. Their coordinations complexes of platinum. These drugs are used to treat almost half of the people receiving chemotherapy for cancer. In this form of chemotherapy, commonly used drugs include cisplatin, oxaliplatin, and carboplatin, but several have been proposed or used are under development. Addition of platinum-based chemotherapy drug of chemoradiation in women with early cervical cancer seems to improve survival and reduce risk of recurrence. The platinum-based drugs are regularly prescribed in the treatment of cancer, and while they are effective, they use in limit to with by their dose. And platinum-based antineoplastic drugs are chemotherapeutic agents used to treat the cancer. They are coordination complex of platinum. Cisplatin is a chemotherapy medication used to treat number of cancers. These include testicular cancer, ovarian cancer, cervical cancer, breast cancer, bladder cancer, head neck cancer, esophageal cancer, lung cancer, mesothelioma, brain tumor, and neuroblastoma. And it is used for treatment of numerous human cancers, including bladder, germ cells tumor, lymphomas, and sarcoma. The mechanism of action of cytoplasm has been associated with the ability of to cross-link with the neuron bases on the DNA to form DNA adduct, preventing repair of DNA, leading DNA damage, and subsequently induces apoptosis cancer cells. Administration rate has varied from 15 to 120 minutes infusion, 1 milligram minute infusion, 6 to 8 hours infusion, 24 hours infusion, or per cancer or cervix, endometrial, prostate, esophagus, kidney, non-small cells, lung cancer, and bone marrow transplant. 75 to 100 mg meter square, 1 4 week or 4 weeks when used with cyclophosphate. Altered Hexlane capsule may be administered either for 14 or 21 consecutive days in 28-day cycles at doses of 260 mg meter square and day. The total daily doses should be given as 4 wide oral doses after meal and at bedtime. There are no pharmacokinetic information supporting this dosing regimen and the effect of food on hexaline and capsule availability or pharmacokinetics has been evaluated. Al- Altritamine is used to treat cancer the ovaries that has not improved, that has worsened after treatment with other medication. Altertamine is a medication that in the class of medication called antineoplastic agent. Side effect: nausea and vomiting, peripheral neuropathy and central nervous system symptoms, mood disorders of consciousness, ataxia, dizziness, vertigo, leukopenia, and thrombocytopenia. Another one is nitrosurase, a group of alkylating agents that have special action. The other alkylating agents listed above cannot travel into the brain, but nitrosurase are able to do so. They can enter the brain because they are able to cross through the area known as the blood-brain barrier, a special area that keeps most drug out of the brain. This action makes these drugs useful in treating certain type of brain tumor. There are three types of carmostine, lomostine, and streptozotocin. And first one is carmostine. Carmostine sold under the brand name BICNU among other medications used mainly for the chemotherapy. In 5 carbon and 9 hydrogen and 2 chlorine and 3 nitrogen and 2 oxygen. In and this medication is used to treat certain type of cancer, including multiple myeloma, brain tumor, Hodgkin disease, and non-Hodgkin lymphoma. And other one is lomostine. In lomostine, original brand name CENU, now marketed as glycine, is an alkylating nitrosurase compound. Indications: Bichno carmostine for injection. It is indicated as the palliative therapy as a single agent or in established combination therapy in the following: brain tumor, glioblast, gli- glioblastoma, brainstem glioma, medulloblastoma, astrocytoma, ependymoma, and metastasis brain tumor, multiple myeloma in combination with Bretnos, and replaced or refractory Hodgkin lymphoma in combination on with other approved drugs. Replace or refractory non-Hodgkin lymphomas in the combination with other approved drugs. The recommended dose of Picno as single agent in previously untreated patient 150 to 200 mg intravenously every 6 weeks. Administer as a single dose divided into daily injections such as 75 to 100 mg and on 2 successive days. Lower the dose when Bicno is used with other myelosuppressive drugs or in patients whom bone marrow reserve in place. Common side effect of Bicno: nausea, vomiting, headache, flushing, injection site reaction. Next one is antimetabolites. Antimetabolites interfere with DNA and RNA by acting as a substitute for the normal building block of RNA and DNA. When this happens, the DNA cannot make copies of itself, and a cell cannot reproduce. They are commonly used to treat leukemias, cancer of the breast, ovaries, and intestinal tract, as well as other types of cancer. Azacitidine, 5-fluorouracil, 5-FU, and 6-mercaptopurine Purine 6 mp, Capti, Capecitabine, Zaldo, Zolod, and Calar and clofarabine and citrabine and dacitabine and fluoridine and fludarabine. Generic name azacitidine. In myelodysplastic syndrome, certain refractory anemia or refractory anemia with giant sideroblast and refractory anemia with excessive blast in transformation, RABT, and chronic treatment cycle for all patients, regardless of the baseline hematology laboratory values in 75 milligrams and subcutaneously or intravenously daily for 7 days, repeat cycle every 4 weeks. The dose may be increased to 100 grams if no beneficial effect is seen after 2 treatment cycles, if toxicity other than nausea and vomiting has occurred, it is recommended that patients be treated for a minimum of 4 to 6 cycles. Common side effect: lung infection, low potassium, nausea, vomiting, stomach pain, loss of appetite, and constipation, diarrhea, joint pain, pain in your arms or legs, feeling weak or tired, dizziness, redness where the injection given, fever, chills, bruising, or other sign of low blood count. Anthracycline is a class of drug used to treat chemotherapy that are extracted from Streptomyces bacterium. These compounds are used to treat many cancers, including leukemia, lymphoma, breast, stomach, uterine, ovarian bladder cancer, lung cancer. The first anthracycline discovered was Dinorobicin, trade name Deonomycin, which is produced naturally by Streptomyces pyogenes, a species of Actinobacteria. Clinically, the most important anthracycline are doxorubicin and daunorubicin and dirorubicin. Anthracycline chemotherapy medication are adriamycin, chemical name doxorubicin, and alance, chemical name epirubicin, and doxil, chemical name doxorubicin, and carubidine donozome. Antimicrotubules agent. Highly dynamic mitotic spindle microtubules are among the most successful targets for anti-cancer therapy. Microtubules targeted drugs including paclitaxel and vinca alkaloids were previously considered to work. Microtubules mass, although these effects might have role in the chemotherapeutic action at lower concentration, microtubule targeted drug can suppress microtubules dynamic without changing microtubules mass. This action leads to the mitotic block and apoptosis in addition to the expanding array of chemical divers. Antimitotic agents. Some microtubules target drug can act as vascular targeting agent, rapidly depolymerizing microtubules of newly formed vasculature to shut down the blood supply of tumors. Protoplasmic cytoskeleton elements. Microtubules, largest cytoskeleton filament in the cells. Taxanes are the class of diterpenes. They are originally identified from the plant of the genus Taxus geos and features of taxadiene cores. Mechanism of action. Taxanes reduce the critical concentration of tubulin required for the microtubule assembly, resulting in the mitotic block at the metaphase, anaphase junction, and in cell cycle phase. Specific activity. In addition to cytotoxic activities and angiogenesis, another mechanism of antitumor activity. Paclitaxel, Taxol, and docetaxel taxotere are widely used as chemotherapy agent. Paclitaxel is an antioplastic agent which acts by inhibitor of cellular mitosis and which currently plays a central role in the therapy of the ovarian, breast, and lung cancer. Therapy with paclitaxel has been associated with low rate of serum enzyme elevation but has not been clearly linked to cases of clinical impairment. Previously, intravenously for over 3 hours every week, followed by the cisplatin or 135 microgram for over 24 hours every 3 weeks. Previously treated various regimens existed 135 to 175 milligram for over 3 hours every 3 weeks. Common side effects of paclitaxel includes hair loss, anemia, joint pain, muscle pains, diarrhea, nausea and vomiting, numbness and tingling in extremities, low blood platelet count, and thrombocytopenia. Next one is topoisomerase inhibitor. DNA topoisomerase are enzymes that regulate DNA topology and are essential for the integrity of the genetic material during transcription, replication, and recombination process. Inhibitors of the mammalian enzymes are widely used antitumor drug. They stabilize topoisomerase DNA cleavable complex by hindering the DNA relegating step of the catalytic reaction, thus resulting in DNA cleavage, stimulating dividing into top 1, top 2A, and top 2B, and atoposide and irinoposide and tiniposide and topotecan. Topoisomerase inhibitors are mainly used in the treatment of colorectal and ovarian. Renotogen, brand name US Camptoser. Injectable solution 100 microgram, milligram, and milliliter. Regimen 1 weekly 125 milligram. Infusion over 90 minutes on days 1, 8, 15, 22, then 2 weeks off, then repeat. Regimen 2 350 microgram milligram square meter for infusion over 32 minutes and common side effects. Constipation, upset stomach, throwing, feeling less hungry, feeling dizzy, sleepy, tired or weak, trouble sleeping, headache, mouth irritation and mouth sores, back pain and sweating a lot, weight loss and gas problems. Other type of drug used to treat other drugs biological treatment are used to treat cancer but are not considered chemotherapy. They often have different side effects than chemotherapy. May are used along with surgery, chemo, and radiation therapy. Targeted work by finding specific substances called proteins or receptors that cancer cells have. The protein or receptor is prescribably targeted by the drug, so normal cells are not affected by the drugs. This is different than how traditional chemotherapy drugs work. Targeted drugs can be used as the main treatment for a cancer, or they may be used after treatment to keep the cancer undergo from coming back. Now we are discussing about hormone therapy. Drugs in the category work on different action of hormones that make some cancer grow. These drugs are used to slow the growth of certain breast, prostate, and endometrial cancer, which normally grow in the response to unnatural sex hormone in the body. They work by making the cancer cells unable to use the hormone they need to grow, or by preventing the body from making the hormone. Immunotherapy. Immunotherapy is the type of treatment that uses drugs to boost or alter a person's immune systems. These drugs are used with certain type of cancer to help patient immune system recognize and attack the cancer cells. And I think this presentation will be very useful for you and you will learn a lot from it. And thank you for your attention.